Good morning, everyone. My name is Ed Curtis. I'm President and CEO of Memorial Health System, and on behalf of all of us, I want to welcome us here today to Memorial Center for Learning and Innovation on a really special day in the state of Illinois. We're very pleased to welcome Governor Bruce Rauner, and he's going to highlight these 5 bills that will have such a positive impact on health in the state of Illinois, and we're certainly happy to be the host here today. I think you're all aware that our governor is a native of the state of Illinois, as am I. I know he loves the state, as we do as well. And I remember when he was inaugurated in early January of 2015, and just a couple months later, we opened this Center for Learning and Innovation. And the governor was one of our first guests. He actually came that Sunday when we did our dedication. Now, why am I telling you this story? Because we allow our speakers, when they come and speak, to write on the wall behind this wood wall, and the governor was actually the first person to sign it. And I remember what he told me that day. He told me this concept that he believes in called ICE, innovation plus collaboration plus education. And he talked about the importance of public-private partnerships in his work prior to being the governor, and he wanted to see that continue, and he loved what we were doing as a private healthcare organization with this wonderful state medical school here. And he wanted to see that continue, and even had his economic development people come over and meet with us, et cetera. And so we think about that every time we're doing something working in the community here, because we do believe in that ICE concept of innovation, collaboration, and education. So thank you, Governor, for what you've done. I would also say that in my time being in this community and being here, very rare to have the governor of the state, even though the capital is just a few blocks away, visit our campuses. And this governor has been on our campus 4 to 5 times. I know he goes to HS St. John's Hospital. He's been over to the medical school. He's very involved in our community, and that's something we appreciate very much as well. So we are going to welcome a lot of guests this morning as we get going here. Certainly, we're honored to have Lieutenant Governor Evelyn Sanguinetti here as well, and she'll be speaking momentarily. Sarah Moscato-Howe, the CEO of the Illinois Association of Behavioral Health, is here. She'll be speaking. David Lloyd, the Director of Policy and Programs for the Kennedy Forum of Illinois. Heather O'Donnell, Senior Vice President of Advocacy and Public Policy for Thresholds. Jennifer Hammer, a friend of our community, certainly the State Director of the Department of Insurance, and then one of our state representatives, Sarah Wojcicki Jimenez, will be speaking as well. And I also want to welcome State Representative Sue Scheer, and thank you for being here as well today, Representative. So we appreciate everybody being here this morning. Now, I will tell you, healthcare is about people, serving people, taking care of people. It's not something any of our organizations can do alone. It requires partnerships. We partner with our medical school. We partner with our colleagues at HSHS St. John's Hospital. But we're really proud that 2 of these bills in particular, Senate Bill 2951 and Senate Bill 3049, seek to strengthen mental health services. Now, right here in the front is the chairman of psychiatry at SIU School of Medicine, Dr. Kari Wolf. Kari, would you stand just for a moment? Kari trained at the University of Iowa, which is renowned in behavioral health. She was on faculty at the University of Texas Southwestern. She's done a lot with 1115 waivers there. She's been instrumental, again, in working with the state of Illinois on the 1115 waiver. But I can tell you, she's making an impact with her colleagues working in this community in improving behavioral health. And I, for one, can't thank you enough for your leadership and being here in the community. Now, I want to tell you a quick story. Every moment in this community and throughout the state of Illinois, we have people that are seeking services for healthcare. We have people seeking services for physical and behavioral health, and I'll tell you, every moment of every day, there's people in need of behavioral health. This building, we train a lot of people. We've trained thousands of people in mental health first aid right here in this building. I know some of the trainees that are here for a class today are actually in the room because they're here for training today. You can walk into Kari's clinic at 4th and Carpenter. You can walk into her other clinics throughout the community, HSHS St. John's Hospital, Memorial, our community mental health center that's here. We're touching a lot of lives, and we just can't do that without these partnerships being formed. So we're really pleased to be hosting this today. So with that, I'm going to introduce the State Director of the Department of Insurance, Jennifer Hammer, and Jennifer will introduce some of our other speakers here this morning. Jennifer, thank you.
Thank you, Ed Curtis, and we appreciate your continued partnership and working towards a shared goal of increasing the services for behavioral health throughout the state. I'm so honored to be here today in a room full of passionate, hardworking people working towards the same goal. Today may seem like the finish line for many of us who have been working on these bills together, stakeholders, legislators, and state employees alike, but it's not the finish line. This is just the beginning. We're going to continue to change and help those individuals that want to recover here in the state. The Department of Insurance has continued to work on many initiatives throughout the state that address mental health and the opioid crisis that continues throughout the nation. And what I can tell you today is that I can confidently say that the governor has, from the first day he got here, tried to do what's right for the citizens of Illinois. And this right here, this package of bills and his continued work through the 1115 waiver and benchmark revisions and other things that he continues to do are exactly what is right for Illinoisans. And these bills, we will have people talk about each of these bills, but in general, they're strengthening parity laws that we want to enforce and make sure that your medical surgical treatment is treated just the same as mental health, and removing barriers for treatment so that we're meeting people at the right place at the right time with the right treatment. And so at the department, we do that with a four-pronged approach. We look at the plans that are rolled out through the compliance process. We reach consumers through consumer education. Just last year, for the first time ever, we went to all 102 counties, contacted every legislator in the state, and handed out information about what sort of services are you entitled to through your plan, a mental health toolkit, something that really reaches the consumers where they are. They're in libraries and schools, and we went there. We physically had boots on the ground from the department, all 102 counties for the first time ever. So we know that all of us are affected by this problem. These are our loved ones, and so they don't know where to turn. And so as we do our work every day, we look at how to improve those services for behavioral health. And so I'm honored to be here today. This is a significant step forward. I look forward to continuing the partnership with our local providers and also with the stakeholders that are here today that represent so many of the consumers that need our assistance, and am happy to introduce just one of those. Sarah Howe with the Illinois Association of Behavioral Health will come talk about just one of the bills. So thanks, Sarah.
Good morning. I'm pleased to be here today. This is a great day for the state of Illinois, and particularly for those that are suffering from behavioral health conditions. This package of bills will certainly help move that forward in terms of people getting critical access to treatment. I'm here to talk about Senate Bill 682, which really has its roots in the opioid epidemic, which we know has devastated both rural communities as well as the city and suburbs across the state of Illinois. What this bill will do is provide immediate access to treatment. It will remove that prior authorization that will give somebody that immediate access instead of having to wait 2, 3, 4 days when they need help right now. So that will immediately get somebody into treatment when they ask for help, when they need that help, or when we know somebody is in need and we have to get them into that treatment center. That's what this bill will do. I'm very pleased to be here to witness the governor signing it. And I want to thank you, Governor Rauner, for recognizing the importance of this bill and the package of bills to ensure that people with behavioral health conditions get critical access to care immediately when they need it. So thank you. And next, I'm very pleased to introduce David Lloyd, the Director of Policy for the Kennedy Forum, Illinois.
Hi, thank you. I'm very pleased to be here. David Lloyd, with Director of Policy with the Kennedy Forum, Illinois. And thank you to Governor Rauner for recognizing the importance of Senate Bill 1707, which has to do with mental health and addiction parity. And with Governor Rauner signing this bill, Illinois will have the strongest mental health and addiction parity law in the country. And that is critical to saving lives, and it's critical to combating our state's ongoing opioid epidemic and also rising suicide rates. When people have equal access to mental health and addiction coverage under their health plans, they get the treatment that they need, and they ultimately live, can live full and productive lives. But too often across the country, we've seen that mental health parity is not yet really reality. And so this Bill 1707 takes a critical step in that direction. And I'm very pleased that Illinois will now have the strongest mental health and addiction parity law in the country. 1707 will increase transparency and accountability for health plans in making sure that that they're providing equal coverage for mental health and addiction benefits. And it also, SB 1707 will also increase access to medication-assisted treatment, which is a critical component of the state's opioid action plan and helping save lives. So I'm really thrilled to be here, and on the 10th anniversary of the federal Mental Health Parity and Addiction Equity Act, which was signed 10 years ago into law, it's very appropriate that Illinois is taking this step today in having the strongest mental health and addiction parity law in the country. So thank you. And now I'll pass it off to Heather O'Donnell, Vice President at Thresholds.
Good morning. I'm very honored to be here this morning and very grateful that Governor Rauner is going to sign Senate Bill 2951, which is the Early Mental Health and Addictions Treatment Act. You would think that early treatment is what we would expect for mental health and addictions, but oftentimes people wait years, sometimes decades, before they are able to get treatment, and they suffer significant debilitating conditions in the lag time that they're able to get treatment. So what this bill does is create early treatment teams tailored specifically for adolescents and young adults who are in the early stage of a mental health condition. And upon federal approval, this will be covered by the state's Medicaid program. And it also seeks federal approval for in-home and in-community treatment for substance use, clinical substance use treatment to help people who are coping with substance use conditions and the opioid epidemic to get treatment in their home and in their community and deal with everyday life stressors. Illinois will be the first state in the country to cover these treatment approaches through the Medicaid program. We are going to be a national leader. And I also want to thank the bill's champions, which were Senator Melinda Bush, Senator Dale Ryder, and Representative Sarah Feichenholz, and also Senator Pat McGuire. And I want to thank Governor Rauner for signing this bill today. It really is a historic bill. And I also want to thank the hundreds and hundreds of advocates across the state that participated in the Healthy Minds, Healthy Lives Coalition, which Thresholds led and helped make this a reality. So thank you. And now I have the honor of introducing Lieutenant Governor Evelyn Sanguinetti.
I guess this bench is for me. It is so great to be with all of you here today. I could honestly say that many of us are here doing a happy dance because we really waited for this with bated breath. You know, one of my favorite duties in being your lieutenant governor is serving as the chair of the Governor's Rural Affairs Council. And in that capacity, the members of this council told me that many times rural Illinois not only felt forgotten, but rural Illinois downright felt deleted. So I thought that it was a wonderful and humbling thing that I would be able to attack these issues head on. So in January of 2017, my outreach efforts landed me in Franklin County at a hospital called Benton Hospital. And there I just started talking about rural health and the fact that a lot of our rural hospitals did not have access to that world-class healthcare for very many reasons. But then the conversation also went on to the issue of telemedicine. And that's where I met a very significant person in this journey. And her name is Dr. Dr. Antonetti. Could you raise your hand? So she's been wonderful and very instrumental, because when we got started talking about telemedicine, I had a lot of questions. But her being an expert in the field, she said that she'd be able to answer all those questions. So I said I wanted a multi-state analysis on how Illinois regulations compared to other states. She gave me that information. I asked her for quality and cost metrics. And as an attorney, I also wondered about the liability aspects surrounding telemedicine, if any. And I also needed to see how telemedicine was working as applied in the field after receiving all of this information from Dr. Antonetti. So I went to many, many rural hospitals to find out how telemedicine worked as applied. And to tell you the truth, when I got started as a non-believer. For instance, I went to a hospital where telepsychiatry was being offered. And my question to the psychiatrist on the monitor is, how are you able to tell whether a patient is self-harming? And if the patient needs to go on antipsychotics right away, how are you able from a distance to be able to administer a blood exam and be able to make sure that those antipsychotics got to the hands of a person that was having a mental health crisis? And I could tell you with absolute certainty that I am today a believer in telepsychiatry and telemedicine as a whole. It really does work. I noticed that there's a trend that there are a lot of communities right now that are using telemedicine, and it's working for them. And it's not only in rural Illinois where we find that the need is so prevalent. The need is all over our great state. There is a lack of that world-class healthcare, and telemedicine could offer that. So, as many in this room have heard me say before, Medicaid clients with behavioral health needs represent 25% of all Medicaid enrollees, but account for 56% of all Medicaid spending. Did you guys hear that? That's significant, 56%. Much of this is tied to the lack of access to mental and behavioral health specialists in Illinois. That is why today is such an important day, because by signing Senate Bill 3049, Governor Rauner will immediately improve access to mental health experts for our Medicaid beneficiaries that need it the most. So I'd like to send a special thanks, of course, to our governor for making today possible. I'd like to give a special thanks to the sponsors out here. And also, I'd like the people that served on our telemedicine task force to stand up or raise their hands, because we've been doing significant work. Thank you. To move that needle, but one person that I must talk about specifically today is Dr. Gubrit Mandir. Thank you very much. He testified to make sure that anyone having any questions before the Senate, before this legislature, anyone having any sort of questions, he was our go-to front person. And so he has been a significant force to make today possible. So thank you very much, Dr. Mandir. Whatever you do, get a hold of one of those pens. And with that, I will turn it over to Representative Jimenez.
Thank you very much, Lieutenant Governor, and all our guests on the stage. I will say that it's an honor for me to be here today. The issue of mental health and behavioral health has been something that we've been talking about a lot in I serve on the mental health committee in the House, and although many of you in this room have been talking about these issues for years and years and years, just this 100th General Assembly is the first time we've had a committee that is specifically aimed at mental health. And so many of the people you see here on the stage, we've become very familiar with and are passionate, and really, along with the sponsor of the bill, the governor, lieutenant governor, have really moved Illinois in a significant way as it pertains to mental health services. I think all of us have been touched either personally or by someone we love who've had challenges with mental or behavioral health, and especially being a representative in downstate Illinois, access to services has always risen to the top in our mental health committee among the advocates and people that we hear from all over the state. So in downstate Illinois, the bills that the governor is signing today are going to have an extreme importance and significance to downstate Illinois. And I'm just so grateful to be here and grateful for the governor's leadership, Lieutenant Governor, and everyone on the stage and your passion for this issue, because we have to continue to work to be better in this area. You know, there is still a stigma around mental and behavioral health, and we need to continue to talk about it. And as leaders in our community, we need to continue to make that process easier, more accessible, and get these services to people as quickly as possible. I'd like to introduce next the sponsor of one of these significant bills, Representative Sue Scheer.
Thank you, Representative Jimenez, and thank you to everyone, not only on the stage, but all of the people here for the part that you played in getting this across the finish line. This is a bill that I was very proud to sponsor, and I've been working on this for probably 9 months, tirelessly trying to make sure that every single piece of the puzzle was in place. I was very honored when I was at an event over here and was presented with an award for a breakthrough in telehealth medicine, and I wish I'd have thought to bring it because it's an amazing picture. And I'm trying to describe a picture, but you know, the picture itself speaks 1,000 words. So it's a picture of a Norman Rockwell, I think it is, and it goes back to the early 1900s. And in the picture, they have a doctor, and then they have a little, like what they thought a satellite might look like, and then a patient, and it was the precursor to all telehealth medicine. And this goes, so we're looking at something that was almost thought of 100 years ago. So to think that it took that long to come to fruition with the signature today, and then finally putting this bill now into becoming a law, it just really warms my heart. I represent many of these communities that were talked about. Many of these rural communities are in my district, as well as this room right here is in my district. And it's just a wonderful thing to see, especially in mental health, that those who need this the most will no longer be deprived of what's rightfully belonging to them. And it just warms my heart that we have such kindness of strangers, doctors who have maybe never met this patient, and yet they're willing to put their life on the line. When doctor testified at committee, I just thought he doesn't even know the people that he's fighting for. And it's just the kindness of strangers, and it's very heartwarming. I wish there was more than just Representative Jimenez and I here today, but the senators and the representatives who fought tooth and nail and took the votes to make this happen, my heart just goes out to them. And it shows when we work in a bipartisan way, we really can make a lot of wonderful things happen. And today is a day that just proves that. So thank you to everyone involved. And it's a wonderful day for mental health, a wonderful day for telemedicine. And this isn't the end, this is just the beginning. We have lots more to look forward to in the future. Thank you, everyone.
Today is a great day for the people of Illinois. Today, we take a major step forward in making Illinois the national leader in delivering high-quality mental health services to every resident of the state of Illinois. We have made historic progress because of our nonpartisan, bipartisan, public-private efforts to bring this to fruition. This is the culmination of 3.5 years of very hard work by many constituents, many leaders throughout our communities. And I'd like to give a shout out again to Ed Curtis and the outstanding team at Memorial Health. This organization here does outstanding work. We're honored to be hosted here, but we're honored as a leader in this advocacy for mental health services. Thank you for your work at Memorial. I'd like to thank you. I'd like to thank every member of the General Assembly. They have worked tirelessly around mental health services with our administration for the last 3.5 years on a bipartisan basis. We didn't let partisanship get in the middle of it. We said we've got to deliver high-quality mental health services. Mental health drives all health. Physical health is determined in large part by mental health. We need outstanding mental health services in the state of Illinois. The members of the General Assembly delivered great results. I'm very thankful. All of us owe them a great debt of gratitude. I'd also like to thank our insurance director, Jen Hammer. She's been a tireless advocate for outstanding insurance coverage for the people of Illinois, so the people of Illinois are protected and provided the care they need. And she has been a champion for insurance parity for mental health coverage, and she's making sure that this is delivered for every resident in the state of Illinois on an equal basis, and she's done an outstanding job. Jen, thank you for that. And many of you here in this room are law enforcement officers, and by the way, in my heart, there is a special place for our police officers and our law enforcement. They keep us safe. They put their safety on the line, and they are passionate advocates for high-quality health care and a special mental health treatment, and they've done a great job as advocates for this. Let's hear it for our police officers across the state of Illinois. And all of you here in the healthcare profession. Thank you for your work. You're doing the good Lord's work in protecting and enhancing the quality of the health for the people of Illinois. It's very personal for me. My mom was a nurse. Many members of my family were in the healthcare profession. I deeply appreciate what you go through and the challenges you face. And I, as a governor, and I, as a private citizen as well, am a passionate supporter for you in the healthcare profession, our physicians, our nurses, everyone in the field. Thank you. God bless you. Appreciate your work very much. Thank you for your advocacy. Illinois is well on track to be the national leader in mental health services. That is because of your advocacy. That is because of your championship. We now have historic insurance parity. We now are advancing telehealth. We're now making sure that we don't have prior authorizations blocking opioid treatment when it's needed the most. We now have a program to help people with substance use issues, rather than going to jail, get into treatment. Let's make sure that the problem is being solved. We're not just punishing people for things that are actually mental health driven. These are important steps. That's what these bills do. And now we no longer have to wait in Illinois. If a young person is clearly showing symptoms of mental health challenge, we don't have to wait years before significant mental health treatment and support can be delivered to those suffering with this challenge. We are being proactive, taking strong treatment steps so to keep people safe and head the problems off before they become much worse. Illinois is now a proud leader in these efforts, and I'm very honored. As governor, we have worked hard, and our administration made this a top priority. These bills are fantastic. Our 1115 waiver that we got from the federal government in our Medicaid program will help make us a leader in our Medicaid mental health delivery and being proactive. And our opioid task force doing wonderful work underneath our wonderful Lieutenant Governor. We are taking the steps to fundamentally, dramatically improve mental health services for the people of Illinois. I'm honored and proud to sign these 5 bills. Today's a great day to celebrate. Thank you very much, everybody. Southeast, Senate Bill 3023. Full house here, full hand. So, there we are. There you go. Thank you all very much. Historic progress. Thank you. Yeah, let's go into the detail. You,
Yep, so Dr. Mander can talk about the telehealth bill.
Yeah, so my name is Dr. Gurpreet Mander. I'm the Chief Medical Officer for HSHS St. John's and also the Executive Director of the Illinois Telehealth Network. Now, Senate Bill 3049 merely addresses the Medicaid payments and reimbursement for behavioral health and brings in parity for all providers who are Medicaid eligible and sites which are Medicaid eligible. It does not cover the question of parity in the state for all. It does not mandate all insurers to pay. As time moves along, we are hopeful, those of us in the telemedicine world, that will occur. So. So telepsychiatry is very well developed. There's good studies out there showing its efficacy therein, and it's a good moment. We actually can do a demo for you at St. John's at 11 o'clock, and you can contact Katie out there to show you how it works. There's telepsychiatry right now is pretty widespread across the nation. It's being serviced. The quality of care is not second to in-person interactions. So it's high definition audio visual. It's HIPAA protected. There's a physician-to-patient interaction, and all the studies have proven its efficacy, and its patients perceive it as no different than in-person interaction therein. So. And this bill, does it expand what we have, or does it allow it for the first time? No, it essentially brings in parity for payment and also makes all Medicaid-eligible sites and providers who are eligible for payments to Medicaid for providing telebehavioral health services. No, it is not an insurance thing. So. So I can just give a few examples. As you go around the state, especially in southern and central Illinois, there's a big paucity and dearth of healthcare specialists, especially in behavioral health. So it provides timely access, so patients will not have to stay in EDs for a long time. Secondly, it prevents unnecessary admissions and readmissions of patients if you're able to get that treatment in a timely fashion. And also it prevents travel costs for the patients and providers having to travel hundreds of miles to get the services they need. So those are some of the return on investment for telehealth therein. So.
Sure. So actually, the removal of the prior auth actually just changes the decision-making power from the payer to the provider. So we're shifting the ability for the provider who is truly seeing the patient to make the decision for whether that treatment is medically necessary at that point, at that time. And so traditionally, the provider makes that decision, but then the payer has some input on deciding whether it's medically necessary. This is just removing that barrier to treatment and making sure the patient is getting that treatment initially. I think you had some additional questions that Mr. Lloyd was going to answer on the mental health parity enforcement provisions. So.
Yes, I'm David Lloyd with the Kennedy Forum, Illinois. And regarding SB 1707, what the bill does, it really strengthens enforcement and compliance with both state and federal mental health and addiction parity laws. And essentially, what these laws mandate is that treatment coverage of mental health and addiction conditions have to be on parity or equitably provided with medical and surgical conditions. And so what this bill really does is it increases transparency so that we can actually make sure that health plans are in compliance. It also takes a major step forward in increasing access to what's called medication-assisted treatment, which can treat, for example, opioid use disorder. And that's really the gold standard of care for treating opioid use disorder. And so it's very important to addressing the state's opioid crisis. But overall, SB 1707 will will really increase access to care by making sure that coverage for mental health and addiction conditions are being provided equitably by both commercial insurers and also the Medicaid managed care organizations.
Governor, our healthcare reporter who is not here asked me to ask about another bill, Senate Bill 336, Senator Harmon, designed to avoid addiction to prescription painkillers and reduce opioid overdoses by giving certain patients quick but temporary access to the state's medical marijuana program. Just wanted to know if you've made a decision on that.
Actually, we'll be announcing that here in the next couple days. We're got to focus on a topic at a time. That one's a very important issue, and we'll be addressing that very soon. These bills are about making Illinois a national leader in delivering mental health services. They are very important. They are great progress done on a bipartisan basis. These bills work in partnership with what our administration has done in achieving a very important waiver from the federal government in our Medicaid programming to get proactive, high-quality mental health services in a way delivered proactively, early in treatment that's never been done before in the state of Illinois. And it also helps enhance the quality of the work we've done through our opioid task force to make sure that we deal with this scourge that's devastating so many individuals, so many families in the state of Illinois. This is very, very significant progress. This isn't directly enabling it, but what it does is go hand in glove and help enhance the effectiveness of both sides. That's a good, I don't know the answer to that. Jen, do you know the answer?
Sure. So the bill that Heather talked about from Thresholds is actually the authority to apply for a waiver, which would allow that interaction immediately on the very first episode. So it's called first episode treatment, and it allows, instead of kind of trying to find treatment over a period of a decade or so, it's intense treatment right from the first episode. So we're really excited about that. That would obviously be something that we would look for matching dollars from the federal government through an 1115 waiver, and this provides us the authority through the Department of Health Care and Family Services to do that.
Thanks very much, everybody.